Now to the coronavirus pandemic. The White House says the U.S. is administering coronavirus shots at a, quote, record pace. More than 74 million people are fully vaccinated, and nearly half of all adults in the U.S. have received at least one dose. This comes as the nation grapples with a rise in infections, a large percentage of which are coming from just 5 states. And Michigan is at the center of the outbreak. Officials there are pleading with the Biden administration for more vaccines. But the head of the CDC says the state needs to toughen restrictions. Mola Lenghi reports.
Nowhere is the coronavirus roaring back more fiercely than Michigan. And tonight, an alarming number of cases in the state, nearly as many now as there were during the worst of the pandemic. New cases per capita are the highest in the nation here, 72% greater than the next highest state. Michigan's positivity rate nearly 3 times more than the national average. And now, nearly 24 hospitals in the state are at least 90% full.
The situation in Michigan is pretty concerning. It's as bad as it was over the holidays. The variants are definitely one of the drivers of it.
State officials begging the Biden administration for help.
We're really encouraging them to think about surging vaccines into the state of Michigan.
But today, this from the CDC director.
The answer is not necessarily to give vaccine. The answer to that is to go back to where we were last spring, last summer, and to shut things down.
The governor today extending workplace restrictions, which allow people to work remotely if possible, as she urges a 2-week pause on indoor dining, in-person learning for high schools, and youth sports. But those are voluntary. In Michigan, high school-age kids are far more likely to be infected than any other age group. More than 1 in 4 test positive, including 15-year-old Niev O'Connell.
When I first got it, I was pretty upset about it. My case was super mild. School is very important to me, so the ability to come play sports and gives my body a time to relax.
The variants that are overtaking Michigan are now spreading across all 50 states, with the B117 or UK variant dominating. And tonight, a new study confirming that variant is 35% more transmissible, but researchers now say it's not more severe or deadly than the original COVID strain. In Michigan, student athletes are now tested every week.
It puts a burden on us. You're just like, wow, this is life now.
What's happening in Michigan today could be what's happening in other states tomorrow.
All Michigan residents 16 and older can now get vaccinated at sites like this, Ford Field, which administers about 5,000 shots a day. And you know, that can't come soon enough, especially for younger children. The White House saying today, once approved by the FDA, kids will likely be able to get their shots at their pediatrician's office. Elaine?
Mola Lenghi, thank you. Joining me now is infectious disease physician Dr. Hlatshwayo Davis. Doctor, welcome. Thanks very much for being with us. So Michigan is now one of the worst coronavirus hotspots in the U.S. The state's governor wants more vaccines from the Biden administration, but the head of the CDC says the state needs to, quote, shut things down. Would vaccines be enough at this point?
You know, those of us in the public health arena have been saying since the beginning, while vaccines are the most important tool in our toolbox, they certainly cannot do this alone. I think this is a combination of a very understandable pandemic fatigue. We've been asking folks to clamp down for over a year now. And for many, that's just run its course. But having said that, we also know that we have a more transmissible and in some cases more virulent strain, the B117, that is also in play. So quite frankly, we need to employ all the tools in our toolboxes, and we cannot afford to relax when it comes to masking, social distancing, hand washing, and most importantly, large gatherings.
So 50% of all adults are expected to have received at least one dose of a vaccine by the end of this week. Is this pace of vaccinations enough? And remind us, doctor, where do we need to be to reach herd immunity?
That pace of a vaccination is incredible. Let's remember where we were in December, where we had vaccinated less than 5% of the population. So what has been achieved by this administration is quite frankly a feat. But the fact that we're still seeing surges in cases, again, I can't say enough. underscores the fact that there is more than just the vaccine at play. Herd immunity is the goal. We need to vaccinate between 70 and 80% of the population to get there. We're not there yet. And so while we vaccinated 50% have gotten at least one shot, we know that to get the kind of efficacy numbers that we saw in phase 3 clinical trials, we need to get to 2. And I do think some people are relaxing a little bit when they know they're coming to get their vaccine or they only have one shot. You're just not there yet. You get the full benefit of this vaccine 2 weeks after the second shot.
Okay, so with that in mind, some states have reported rare cases of people being infected with coronavirus after they were vaccinated. Is that normal?
Yes, I mean, we knew this. No vaccine is 100% effective. I like to tell people to take a look what's happening with influenza right now. We have a vaccine there that's only 50 to 60% effective on any given year. Look how that changed, incredibly changed the influenza epidemic and has increased both morbidity and mortality. But beyond that, this flu vaccine has been unlike anything I've seen. We don't even talk about flu. And that's because we're seeing the benefit of some of these other cases. So again, the fact that we're seeing rare cases with this vaccine is still such a triumph. But it's the reason why from the beginning we said even once you've gotten your second shot, you still need to be masking and social distancing and all of the other things I've mentioned already, because we're not there until we reach herd immunity. Herd immunity is the goal. Anything short of that requires us to do all the things that we've been asked to do.
Well, new numbers from the CDC show racial and ethnic minorities are hospitalized with COVID at higher rates compared to people who are white. Now, the head of the CDC has declared racism a public health threat. How has this issue complicated the fight against the virus, and what needs to be done to address it?
I have to tip my hat off to Dr. Walensky. She has done something that we have been calling for, quite frankly, for decades. COVID-19 joins a long, long list. Let me be clear, a long list of conditions for which Black and brown people are disproportionately affected. To see this again and to see it happen in such devastating degrees is quite frankly so hard for someone like me to see, especially because it's obviously personal. So for the CDC to take this very clear stance and to not only give lip service, right? What's different about this is the very clear dedication to funding and policy that will see this happen. The CDC just a few weeks ago released close to $6 billion to center vaccine distribution efforts in the community organizations and leaders who have earned the trust of their communities. And we have seen vaccine hesitancy, or what I prefer, vaccine deliberation, which is appropriate questions for people who have valid mistrust, go down from 67% in October to now 25%. This works, folks. If you dedicate funding and policy, change is there. So now what we need to work on is sustainability so that that change can be seen across the board, even after we've gotten on top of COVID.
Right, because the evidence has been clear that you do see disparities in outcomes for various groups. And so the questions must be asked, why and how can those questions be addressed? Let me ask you more broadly here. Global coronavirus cases, doctor, have been rising for 7 consecutive weeks. Nearly 800 million vaccine doses have been administered around the globe. What is driving that increase in infections?
You know, unfortunately, people need to understand that global vaccine equity impacts the U.S. We do not exist in a vacuum. So if we do not make sure that especially low and middle income countries around the world have access to the vaccine, as well as resources to be able to address COVID appropriately, this is never going to end. And so while I absolutely commend the efforts of COVAX and the significant funding, the U.S. is the single highest financial donator to this worldwide global vaccine effort, we're not nearly there yet. And so the problems of the world will impact our borders. It's so important that we focus on this, and it's so important that this is addressed. What is driving it, though? quite frankly, a poor infrastructure in countries that were hit even harder than we were. And to make it worse, strains like the South African strain or the strain in Brazil and now India that is now even causing much wider devastation.
Right, the pandemic is really revealing the difficulties and the challenges for healthcare systems, not just here in the country, but all over the world. Dr. Hlatshwayo Davis, thank you very much, doctor, for your time.
Thank you so much for having me.